month is Colorectal Cancer Month, so I guess that it was appropriate that we find out more about colorectal cancer. To talk about that, I'm very pleased to welcome the Chairman of the Department of Surgery at Phramongkutklao Hospital, who's also the President of the Society of Colon and Rectal Cancer Society of Thailand. I'm very pleased to welcome Senior Colonel Assistant Professor Dr.Parinya Thavichaikarn. So good morning and thank you for joining us.
Yeah.
Now, firstly, when we talk about colorectal cancer, we're really talking about the colon and we're talking about the rectum. And this in Thailand is one of the main causes of cancer now, I believe.
Yes, not only in Thailand, but all over the world, colorectal cancer is the main disease of the population. We can say that in Thailand, colorectal cancer is the third cause of death of the Thai people. But in the Europe and United States, it's the second leading cause of death of the population in Western world.
Why, in fact, is it a different level in Thailand to the Western world?
Because in Thailand, the first leading cause of death is the liver cancer, the second is lung cancer, and the third is colon rectal cancer. But in United States and Europe, you don't have liver cancer. You have very, very small number of liver cancer. The first one leading cause of death is the lung cancer, and the second one is the colon rectal cancer.
So it very much depends on the environment and I guess the food we eat too.
I think that is something like the epidemiology spread from the Western world to the Eastern world. When I was young, colon rectal cancer used to be lower than this. But nowadays we change our lifestyle to be very, very westernized. So we have a lot of disease that we have we don't have it before, such as coronary heart disease, and then the colorectal cancer is another example.
So instead of taking the best from the West, we've taken the worst from the West.
Yeah, I think now the West, the Western people, they go more east for the food. They eat
and
more
meditation
vegetable.
and lifestyle, exactly.
They exercise more. They want to go back to the nature more than the civilization. They want to buy, they want to walk, to run more than anywhere they go by the car.
Now, is colorectal cancer more prevalent in male or female?
Well, the male is a little bit more than female because we don't have breast cancer and we don't have cervical cancer.
Yes.
So they said God never,
differentiates.
Yeah.
When we actually look at the reasons that we get it, I mean, people would say that it's genetic to a certain extent. But before the interview, you were saying maybe the genetics are 30%, but the main thing is how we live, what we do, what we eat.
Yeah, genetic is mean that it can be transmitted from the father or mother to the son by the small in the body that we call the gene. But colorectal cancer, even it occur because the abnormal of the gene. But 70% it will transfer from father and mother. But only 20 to 30% that is inherited. The rest, the majority, is happen because of our own lifestyle. Not because the father and mother give the bad thing to us, no.
Because we give the bad things to ourselves.
To ourselves. You can see that nowadays we eat more about animal fat, more than the veggie or the fruit. We have less exercise. We're getting bigger, fat. And
Cuddly.
And then we smoke a lot, we drink a lot, and this kind of lifestyle it increase the risk to have colorectal cancer.
Now, is there possible to prevent this particular cancer? I mean, I know that, we are what we eat, as people say, but, is there any way we can check?
Yeah, it's easy to say that don't smoke, don't drink, eat a lot of vegetables, drink a lot of water, exercise every day. It's easy to talk, but it's very difficult to practice to do it. So the doctor can help you by recommend you have the regular screening or regular checkup. At the present time, the recommendation is start at the age of 50. If that that people, they don't have the family history or don't have the inflammatory bowel disease. Normal operation start at the age of 50. And the screening or checkup can be either we look at the blood in the feces, which is very easy. Take out a small amount of feces, put the reagent in the feces. If the blood present in the feces, the color will change.
Is that a 100% check?
No, it's 70%. Yeah. But we do it by repeat it many times. We recommend to do it every year.
Right.
Yeah. And the second thing is to do some X-ray that we call it barium enema, which you can do it any hospital in this country. The big hospital, they can do it. Barium enema, we can detect even the benign tumor, which is not cancer, about size about 1 centimeter. Yeah. Normally, people, they don't know that they can prevent colorectal cancer very easy. And another thing, if they have the regular checkup, even if they find cancer, they will find in early stage that we can call it curable stage. Or let's say in stage 1, we can cure people 95% by surgery alone.
Now we have this cute little teddy bear is it a teddy bear? Yes. A cute, and also the apples to actually celebrate and to talk about the colorectal cancer month. What else are you doing? You're trying to tell people to eat the right thing.
Yes, because March is we call it Colorectal Cancer Awareness Month. It means that because this disease, we can be prevented, we can be treated, and we can beat them. So if our duty is to educate or to transfer the message to the people to have themselves change the lifestyle, to come for regular screening. So we use the symbol of this kind of thing. We call it yes, and the blue star with the ribbon. This is international mark. And then we said colorectal cancer preventable, treatable, and beatable.
Very nice slogan. Well, I hope that people watching this program will actually really take note of what Dr. Parinya said, because if as beatable, it's just a matter of going and having that checkup. Thank you very much for joining us, and I hope that we'll have less patients for you as for surgery, but more people actually having the check. Thank you very much.
Thank you.
Thank you.
Bye.
We'll now go to Brett, and he's going to give us Did You Know?